I am pleased to host with Governor Polis this important session on improving the safety of our roadways, which will highlight state strategies to address traffic fatalities through proven impaired and distracted driving policies, support for advanced transportation technologies, and investments in infrastructure to improve safety for all road users. Despite several years of improved safety on our roadways, traffic safety remains an issue of concern for every one of us governors, as nearly 40,000 people are killed in motor vehicle crashes annually. 94% of those crashes are caused by human error, and a significant portion involves some form of impairment, either drunk or drugged driving. There are a number of other causes that contribute to traffic-related fatalities and injuries, including distracted driving. Each day, approximately 9 people in the United States are killed and 1,000 are injured in crashes that involve a distracted driver. With 22 new governors, now is an important time to recommit to addressing issues of impairment, as governors hold some of the most important levers that can be used to create opportunities and partnerships to reduce the number of traffic-related injuries and fatalities. In my state, in the state of Michigan, we have taken steps to work collaboratively across disciplines with our public safety, public health, and transportation agencies, with private partners and organizations, as well as foundations, like in my state, the Kiefer Foundation, which was established by a gentleman named Steve Kiefer after his son was killed by a distracted driver just a few years ago. Efforts to bring awareness to traffic safety and reduce the number of traffic deaths make all of our roads safer and all of our families and people on the road safer. So today we're going to hear from a group of great experts. We've got Dr. Grant Baldwin here at the panel. He's the director of the Division of Unintentional Injury Prevention at the Center for Disease Control and Prevention. We've got Mr. Brian Barnard, the Senior Advisor to the Secretary at the U.S. Department of Transportation, and Ms. Helen Whitty, the National President of Mothers Against Drunk Driving. Our important federal partners and leading advocates will give us perspective as we have this important conversation of how we decrease fatalities and serious injuries. But before we go on to our speakers, I'd like to invite Governor Polis to share his thoughts on the importance of this issue and some of the things that he's been able to work on in Colorado.
Thank you, Governor Whitmer. I'm glad to be part of this. Well, thank you, Governor Whitmer. I'm really excited to be part of this conversation. It's a very important one. Over 50 years ago, in 1966, our nation faced a record number of traffic-related deaths and fatalities, and it was governors at the NGA meeting that really identified traffic safety as a priority and joined with local leaders to improve safety. Now, 50 years later, traffic deaths again are one of the leading causes of death nationally, and just as governors did then, today too we recognize how safety impacts our states and the lives of our citizens. In addition to tragically claiming about 40,000 lives each year, traffic crashes impose a large financial and economic toll in our states. In 2016, the estimated cost of motor vehicle deaths and injuries and property damage was $432 billion. That includes lost wages, medical expenses, employer costs, property damage, really a holistic look at all of the costs associated with traffic accidents. Of course, most tragically, traffic fatalities and serious injuries leave a long-term impact on loved ones, on families, on friends, to kids, our neighbors, colleagues, the broader community. As governors, we truly have an opportunity to directly impact the policy levers that can reduce fatalities and injuries on our roadways. It's not just an issue for civilians, but it's also an issue for law enforcement and our Department of Transportation workforce. I've been in office just over 6 months, and I've already attended 2 funerals of state troopers who were killed when they were struck by vehicles, and we also lost Department of Transportation workers. In Colorado, we're taking common sense measures like clearer stripes on roads, building better shoulders and passing lanes in rural areas, new education programs to reduce impaired driving, new laws to prevent passing of snowplows. But most importantly, we're talking candidly about creating a culture of safety, a culture of safe driving behavior, through an extensive outreach program through our Department of Transportation called Whole System, Whole Safety. So for this session, we hope to continue this conversation that really, in many ways, began at NGA over 50 years ago about how states can leverage the efforts and advancements made over the last several decades to truly improve safety on our roads.
Thank you, Governor Polis. I want to extend a warm welcome to all of our guests here today, and thank you for participating in this. Hoping that perhaps each of you will share some opening comments with us on the issue. And Dr. Baldwin, if you'd kick us off, that'd be great.
Great, thanks so much. It's really an honor and privilege for me to be here. In my 5 minutes, I want to do a few things. I'll tell you a little bit more about what we know in terms of burden and risk factors. I'll talk about what we can do about it, including a vision for the future. And finally, I'll talk a little bit about what CDC specifically is doing. So undergirding that 40,000 deaths, for every single death, there's 8 people who are injured and 99 people who are treated and released from an emergency department. And you heard about the economic costs and how staggering they are. There's real gains for us to make. Some of the risk factors that we'll, I think, talk about over the course of the hour, some of them are consistent over time. I'll mention just 3 of them: restraints, speed, and alcohol, and now drugs. In terms of restraint use, we've seen a huge increase since the early 1980s. It's gone up from around 10% to 90% of our fellow Americans are buckling up. That still leaves 27.5 million people who aren't buckled up. And we know that upwards of 50% of people who die in car crashes were not restrained at the time of the crash. Alcohol continues to be involved in 1/3 of all traffic fatalities. Some data from CDC, we know that there are 121 million episodes of self-reported alcohol-impaired driving annually, and less than 1 million people who are arrested for a DUI. 70% of people who die in a alcohol-impaired driving-related crash had a BAC level above 0.15. In terms of speed, 50% of us report driving over 15 miles an hour faster on our highways and over 10 miles an hour faster on our city streets than the posted speed limit. And we know that just a 5% reduction in speed can reduce crashes by upwards of 30%. So what do we do about it? NGA is part of a larger initiative that I suspect Brian may talk about as well, called Road to Zero. The vision for this program is fairly simple: get to 0 traffic fatalities in the next 30 years. What undergirds that vision is these 2 core principles: that it's simply unacceptable to lose a fellow American on a US road, and that a recognition that we're all human, we make mistakes, and so we need roads and cars and rules that govern our driving behavior that keep us safe at every turn. There's real power and promise, and one of the core tenets of Road to Zero is to double down on proven evidence-based interventions. And so some of those things include, like on restraints, high visibility enforcement and media campaigns to increase seatbelt use, as well as making sure that kids up to the age 5 are up to age 5 are restrained in an age-appropriate booster seat. It's a specific example. In alcohol, we can talk about sobriety checkpoints, ignition interlocks, improved use of drug recognition experts, as well as potentially lowering the BAC standard, as was done here in the great state of Utah. And finally, in speed, there's obviously enforcement capacity, automated speed cameras that can be helpful, as well as other traffic calming measures, roundabouts and whatnot, that can make a big difference in terms of reducing speed. So in my remaining time, I'll tell you a couple of things about what CDC is doing. We have a program called MVPICS, or Motor Vehicle Prioritizing Intervention and Cost Calculator for states. What you do as a governor is your State Highway Safety Office has a budget. They enter that budget into this program, and it looks and identifies what interventions, if stood up, could save the most lives and avert the most costs if implemented in full scale. It's a program that NGA has helped support over time. We've grown and evolved, and it's much easier to use. I'd encourage you to take a look at it. Happy to provide after the link to that. And finally, this is something we're going to be releasing later this year, a program called LINKS, or Linking Information for Non-Fatal Crash Surveillance. So we obviously exist in a fairly sophisticated environment where we have multiple data streams that can be connected, from health data to police crash report data to even DMV data. So we're trying to think creatively about how to do that work, and we're releasing a guide to states to do that work more robustly. I think that's my time. I will, I guess, turn it over now to Brian, but eager to participate in the conversation over the course of the next hour, so thank you so much.
Thank you. Good morning, everybody. I'm going to speak to you about the National Highway Traffic Safety Administration at USDOT. Our mission is to save lives, prevent injuries, and reduce the economic costs associated with roadway crashes on our nation's highways. We do that through three main buckets. We conduct vehicle research, vehicle safety research, and that includes crash testing and the 5-star safety rating that you're probably familiar with when you buy a new car. It's the NCAP program. We also do research into different safety measures that are incorporated into vehicles, and you've seen a lot of new technology come onto the market in the last few years that we've been doing a lot of research into proving out and helping the development of. Secondly, we do behavioral research. So we do research into motorist behavior, distracted driving, impaired driving, speeding, and occupant protection like seatbelts to make sure that, as Grant mentioned, that everyone who's using the roadways is buckling up, that they're obeying the traffic laws in the states, and that they're driving sober and not distracted. Our third bucket is the partnership with the states, and that's really where you can help. We give out over 2/3 of our budget every year to the states. That's over $600 million. Some of that is formula funds that go to support your highway safety activities in the state, that you generate a highway safety plan in partnership with your highway safety office. And then another part of that is incentive grants, which are law-based. If your state legislature passes certain laws on impaired driving, distracted driving, occupant protection, you'll get additional grant money for you to use at the state level. Finally, I want to talk about our communications and high visibility enforcement campaign. We conduct research into developing nationwide campaigns. I'm sure you're familiar with most of them. Click It or Ticket has been around for a long time. We also have Drive Sober or Get Pulled Over. And actually, this last winter, we released a brand new campaign, which is if you feel different, you drive different. Drive high, get a DUI, which is targeting, from all the anecdotal evidence we've seen, an increase in drug-impaired driving. So really looking forward to the conversation and answering any questions that you might have today.
It's an honor to be here. Thank you to the NGA for having us at the table, and thank you for governors for making traffic safety a priority. It's an honor to sit next to these two experts. More Americans have died in car crashes in the last 19 years than in both world wars, according to a story by the Washington Post just this week. As national president of Mothers Against Drunk Driving, I represent the hundreds of thousands of victims of drunk driving crashes. And despite decades of progress, we are still facing drunk driving deaths that are up at 11,000, almost 11,000 every year. Drunk driving is still the #1 cause of death on our roads. Each death is preventable, and it causes a ripple effect across families and across our nation. And I know that pain because on June 1st, 2000, a sunny afternoon, my 16-year-old daughter went rollerblading. "Don't worry, Mom, I'll stay on the bike path. I'll be right back." She went to the end of our driveway, flipped around backwards, blew me a kiss, and that was the last time I saw her. Her 13-year-old brother was putting on his rollerblades to go with her, and she said, "Mom, keep him home, I want to go fast." She was my firstborn. She put me through my mom paces. My husband and I thought we had our dream family. A teenager impaired on alcohol and marijuana ended our dream. My daughter looked up and saw a car spinning on that bike path and there was nothing she could do but die. That's what we want to stop. I can't even begin to try to explain what those first years of deep, dark grief were like. A funeral for a 16-year-old, packing up her things, a husband who identified her at the crash site when he went looking for her because she didn't come home. Nobody should have to do that. Nobody. And that's why I'm so grateful for your emphasis on this vicious crime. Thank you. We're working hard because you know what? MAD was there for me. I can't tell you about those first few years, but MAD was there. They gave me a platform, they educated me, and I'm standing here today on that platform because I understand. I hear the stories across our nation in all our states of what happens to families. In 2006, MAD promoted a campaign to eliminate drunk driving, which the very first part of that is law enforcement. As you all recommended, we have got to support our law enforcement. They are the #1 people out there right now on our roads that are protecting us, and it's dangerous work, dangerous work. So that's our #1. We are also deeply concerned because drunk driving arrests have gone down, and as they have gone down, the deaths have gone up. So we need to support those law enforcement officers that are out on our road. Sometimes their presence alone saves lives. It stops all crime, not just drunk and drugged driving. And as a governor, you can make the difference by making traffic enforcement a priority. Second, MAD believes that every convicted drunk driver should have an ignition interlock. We're working hard to pass laws in all states. We have 33 states now with all-offender ignition interlock laws. And it's a small breathalyzer that a person who's been convicted of drunk driving, if they start their car, they have to have a breath sample. And it allows them to keep working. Taking away their license just doesn't work. Up to 75% of people with revoked licenses continue to drive anyway. So it's killing people. 33 states, New Mexico was the first one. And as a governor, you don't have to wait for your state lawmakers to propose these laws. You can propose policies on your own. We've seen this happen. In 2011, Governor Cuomo ensured that counties would have the resources they need for Leandra's law. And that he also worked hard to require all-offender ignition interlock in Maryland. Thank you. In 2016, Governor Hogan made it clear that he was going to support Noah's law when a DUI traffic officer who was arresting a DUI was killed. So thank you. You worked hard and also have been outspoken to make sure that the DMV keeps that up. You worked hard from the day it was proposed until the day you signed it. Thank you. And in Massachusetts this year, I got to visit Governor Baker, and he had proposed legislation requiring interlocks for all convicted, drunk drivers. I had the pleasure to meet with Governor Baker this year, and we hope Massachusetts will be the next state that will have all offender interlock laws. Thank you. The third step of our campaign to eliminate drunk driving is technology. Technology joining in is going to stop drunk driving. There is a specific technology that requires breath or touch sensors. This is different from ignition interlocks. This would be a technology, and Brian can really talk on this, if a person, it's a passive system. And if a person is detected through breath or touch, the car won't start. How about having that as a standard safety feature in all our new cars? And finally, our campaign calls for personal responsibility. Talk to everyone in your circle of influence. We can do this. If you drink, don't drive. If you drive, don't drink. It's a simple equation that we can all get behind. There are so many other opportunities nowadays for getting home safe. Let's get everybody home safe so that I don't have to meet any more families or hear any more heartbreaking stories about senseless death. So, in behalf of my daughter, Helen Marie, and those victims who are not here today, thank you for making this a priority. Together, with all of us together, we can make this a nation of no more DUI victims. Thank you.
Okay, so thanks for those remarks, and Helen, thank you for turning tragedy into a passion and a mission around making sure that others don't have to go through what you went through. Let's go to our fellow governors to see if you have any comments or questions or anything you want to share about anything going on in your state. Governor Pritzker.
First, I want to thank the panelists. Thank you for your time, for coming here to the NGA. It means a lot to all of us, and particularly for those of us who are new governors, to have the opportunity to hear your thoughts, ideas, and direction. I think is highly educational, and as Governor Whitmer said, there are 22 new governors, and so this is a great time for you to renew the effort to focus on traffic safety and smarter roadways. I wanted to go to a question about, I'm highly sympathetic with everything that was said about the issues around drunk driving and impaired driving. I have a 16-year-old daughter who's just a new driver, and a 14-year-old who will be getting his permit starting sometime soon. And I worry a lot about the peer pressure that goes along with being a teenager and the driving, some other nodded heads around the room with teenagers. So, but I wanted to go to a different question around the technology that's available today for safer roadways, and in particular this vehicle to everything technology. Maybe Brian, you could start with some remarks about this, but there are two standards, as I understand, that exist out there that nothing's been decided upon about which of these standards the vehicles will carry, but it's going to make driving safer for everybody. And I worry because we're going to make substantial investments in Illinois in expanding broadband, expanding communication coverage to areas of the state that have never had it before. And I want to make sure that we're doing it in a way that feeds into the need for, V2X technology. And if we go the wrong way, it's going to cost us a lot more than if we figure it out up front. So can you tell us where that, cellular technology, Wi-Fi technology, what is it that we should be thinking about in our states in order to feed into the future of cars?
Sure, that's a great question. I'd be happy to answer it. Since 1999, the FCC had set aside a certain amount of radio spectrum for intelligent transportation systems, ITS. And that basically enables dedicated short-range communication, which is fancy Wi-Fi, for cars to communicate with one another through transponders and transmission on the vehicle. And they'll be able to communicate with another vehicle in the range and infrastructure that's connected in the range as well. And there's a lot of possibilities there. We're most interested in the safety possibilities because there are plenty of times where you have roadway intersection collisions where a driver would say, I didn't even see the other guy coming. I had no idea he was there. That technology can really help make a difference in cutting down on those traffic crashes. So we're really interested in the safety potential. As to your point about two technologies being there, right now DSRC is the only one that can use that radio spectrum. Now, the FCC is taking a look, or has mentioned that they will be taking a look at what might come from that, what other technologies might be out there that could use the band as well, that dedicated spectrum. CV to X is another one, that's cellular. So you have fancy Wi-Fi, and then you have cellular. Cellular also holds significant potential, and we're doing a lot of research to try and prove it out. So we're working with FCC and the Department of Commerce, NTIA, to do phase 2 of our testing. We're gonna do it on a test track, and that's gonna start later this summer. We're gonna do it at Aberdeen, in the US Army base in Maryland. We're gonna do track testing to see how that technology works. And we are looking forward to sharing those results with everybody, probably towards the end of this year.
But can I just follow up with
Absolutely.
the problem with DSRC, as I understand it, is that we'd have to put in all new technology. You may have reserved spectrum for it, but that means new equipment and new towers and new coverage, right, where cellular mostly already exists, and it is maintained by the cellular providers and wouldn't cost the state, much anyway. And so I worry about the cost going forward.
Sure.
Of going one technology route versus the other.
Yeah, that's a great point, Governor. And it's something we've heard from a lot of the states that are trying to make those investments in DSRC or CV to X. They want to know, where's the marketplace going? We're hopeful that the technology may become interoperable in the future, but for now, the only one that's been proven and is allowed on the spectrum is DSRC. And the FCC controls the spectrum, so we have to work with them.
Thank you, Governor Ducey.
Thank you to the panel, and Helen, I'm sorry for your loss. Thank you for sharing your story, and thank you for the work of MAD and the work that you've done. You've truly changed the culture of the country, and I know there's much more work left to do, but I'm convinced that young people are making better decisions than were made in the past. In Arizona, we were able to defeat recreational marijuana in 2016. We do have medical marijuana, and I know these initiatives are spreading across the country. I'm curious to what MAD's involvement is. You've made such a difference, the Mothers Against Drunk Driving, and we have both science and technology to prevent and identify on the alcohol side. I think it's more ambiguous on the drug side, and it concerns me, and I'm just curious as to first with Helen, but what the rest of the panel can tell us about how we're going to have safe roads in these situations.
Thank you, Governor. It's a challenge. It's a challenge. My daughter was killed by poly drug use. And while we know now that drunk is still the #1 killer, drugged driving is coming along. So MAD has added that to our mission. We are indeed fighting drugged driving. In my state, also in Florida, where I'm from, it's medical marijuana. MAD wants to fight against using marijuana and driving. We do not take a stand against marijuana as whole, because for some places it's legal. So to me though, I wish the science had been definite before this process started, because the science isn't there yet. But the science that we have shows that how dangerous marijuana is, especially for our young people. I went into schools with MAD for 9 years. And I had students say to me, "Oh, Ms. Whitty, don't worry, we drive better when we're on marijuana." And what really was stunning, I had parents say to me, "Oh, don't worry, they're not drinking alcohol, they're only smoking pot." So this is a huge issue that I think we're all facing, and so MAD's out there. And poly drug use, specifically alcohol and marijuana, is more than double the impairment. That's an education piece. So thank you very much, and I'm going to turn it over to my CDC expert and to Mr. Bernard.
Great. I'll just add a couple of things. My division's also responsible for the CDC response to the drug overdose epidemic. So, as you all know, 70,000 Americans losing their lives to drug overdoses, 2 or 3 of those that are opioid related, but we've seen a huge increase in meth and cocaine use as well, both with and without opioid co-involvement. In terms of marijuana, there's data to suggest that up to 68% of Americans now live in medical or recreational marijuana states. And the patterns that we're seeing, so as you might expect, use is going up, but frequency of use is going up, the potency of the products that are being used is changing, and the modality of use is also changing. So smoking is the most common modality of use, but edibles are also on the rise, and the sort of physiology of how THC is metabolized depending upon the use patterns really impact impairment. We were talking before the session started about the National Roadside Survey. We do know that marijuana or THC is on board. It's the most common drug on board for the last National Roadside Survey. Unfortunately, the ability for officers to detect impairment is largely uneven. I think Arizona is the state that has drug recognition experts. The challenge is that there's not enough of them, and the ability to deploy them frequently as needed is a challenge. And then, unlike alcohol, where you have a roadside test that can be done quite efficiently, that doesn't exist yet for marijuana. But it's an area of activity and research, and maybe Brian can speak to this. I think we're getting closer, but the whole issue of drug-impaired driving and polysubstance, as Helen pointed out, is really concerning and should be concerning to all of us.
Yeah, I would be happy to just add a couple of things on that. So from our perspective at DOT, we're focusing on research, but what we're also doing is getting resources out to law enforcement to make sure that they have the tools they need to combat an increase in drug-impaired driving. Actually, earlier this month, we announced a $2.3 million cooperative agreement award with IACP, the International Association of Chiefs of Police, to help train law enforcement to become DREs at the state level. So if you have a DRE, you're going to need more than one across the state, obviously. So if we can increase the number of trained officers that can successfully identify drug impairment on drivers, it's going to make a big difference. And hopefully that deterrent effect will reduce the number of drug-impaired drivers on the roadways.
And I would add, Colorado's long been a leader in cannabis reform. Our new efforts include allowing delivery of marijuana. So we're moving away from the risk of people driving while impaired by having legal delivery to people's homes. We just passed the enabling legislation around that, beginning with medical marijuana and then moving to full regulated sale of marijuana. So people can exercise, in our state it's a constitutional right to use marijuana in their home without the risk of them using it somewhere else and driving. So we're really looking at a wide variety of tactics to decrease that risk. Governor Herbert.
Thank you. Again, a very important and emotional issue. I don't think anybody supports driving while you're impaired. Sometimes how we define impaired, those where we end up having some problem. As some of you know, certainly I hope, Helen, you know that Utah has reduced our blood alcohol content from 0.08, which is most of the nation, down to 0.05. We're the lowest in the nation. Not without controversy. And it's probably too early to say whether we are going to be successful or what the outcome of that's going to be, but at least our DUIs are down right now, and so maybe it's having an impact. It appears that more people are getting on board with the phrase you used, if you're going to drink, don't drive. Heineken Beer, and Jackie Stewart is our spokesperson, the famous race car driver, does a commercial on that where he says if you're going to drive, don't drink, period. That's maybe a cultural change that we need to, in fact, address. I'm curious to know if any of other states are thinking of reducing their blood alcohol content from 0.08 to something lower. In Europe, 100 countries have it down to 0.05 or lower. Some have 0. So around the world, that certainly is a trend that seems to be taking place. Also, as we kind of are entering the age of the Jetsons, who knows what's going to happen over the next generation. But unmanned vehicles, I mean, I came from the Paris Air Show and saw drones that are not only going to be carrying packages, but eventually people, like cabs. and we're going to have, you know, streets in the sky, and what's going to take place there, and how is that going to help us? When we see the statistic that 94% of our crashes are human error, I guess the question to you is, what can we do in all the different arenas to reduce human error? For example, I'm just totally sick and tired of people driving down the road talking on their cell phone. You know, looking in the mirror, fixing their hair, eating a hamburger. The distracted driving is a big issue, I think, for us, and we're trying to work with our legislature to pass a law on that, but we're having some resistance, surprisingly so. So the age of the Jetson, what are we going to do to eliminate human error?
I appreciated your comment about 0.05. CDC had funded some work that looked at what if every state had 0.05, what would be the impact? It would save between 600 and 1,200 lives, avert up just shy of 50,000 injuries, and have a direct cost benefit of $34 million. So, you know, these are real numbers, real lives, real people named Helen Marie, whose lives would be saved if every state had 0.05. So just to put the benefit in context from CDC-supported work.
Yes, and I'll be the emotional part. Thank you. Thank you for 0.05. Impairment is impairment, and 0.05 is impairment. The data is there now. So it would be wonderful. MAD is happy to support any state that wants to bring forward 0.05. I was in Michigan just recently. And also in New York and California. So we're hoping that this will happen, but thank you for your leadership, Governor. And let's get this conversation rolling. Thank you.
Governor, I can add on the distracted driving front too. One of the best things that you and your fellow governors can do is to support your law enforcement's high visibility enforcement campaigns on that. We have some safety materials that are all available for free, trafficsafetymarketing.gov. Support your law enforcement when they're making stops for folks who are driving on their cell phones. It's really important to show that you're prioritizing it at the state level. And all of those materials, if you can share them on social media or weave them into your statements and press releases, that would go a long ways as well. Thank you.
I have a question for you about those information approaches that you take in public relation campaigns, and we're seriously trying to improve safety. We just passed a hands-free law this year. And are looking at other ways to do so. But you talked about if you feel different, drive different, if you drive differently, or click it and ticket. And do you have substantive data that shows how, if states invest in those kinds of public relations campaigns in partnership with DOT, that actually shows returns for those? They seem like a good idea. You talked about anecdotal stories around the return on that, but I'd kind of like to know data.
That's a great question, Governor. So here's how it works. Congress gives us about $30 million every year to partner with the states to help fund the overtime for law enforcement to go out there 3 different times a year to focus on click it or ticket and to focus on impaired driving. So we put out the messaging. We do all of the safety campaigns and materials. And then at the state level, you have law enforcement go out there and do the high visibility and enforcement, because you need both sides of it. You need the public education and the awareness, and you need the enforcement, the visible presence of law enforcement. And then the best part of that is it does make an impact. The problem is, from the data that we've seen, it's an impact only during those times that we have an increased enforcement presence. So once that enforcement goes down, you see an increase again in the prevalence of that bad driving behavior. I'd be happy to pass that along to your office.
Governor Burgum.
If a plane crashes on the other side of the world, it's front page news in America for days and weeks. And as was pointed out by the panel, we're killing a plane crash a day, day in and day out, and we've been doing that for decades. Brian, when you're talking about Road to Zero and had a 30-year time horizon, with the technology that's coming, I guess I'm questioning why 30 years and why that time horizon, and then also for the whole panel, the cultural issue, because if we've had one death in America in commercial aviation in the last 9 years, just one, and that was the individual who was sitting by the window when a part flew through the window. When we have autonomous vehicles represent an opportunity to be better than humans, because if 94% of this is caused by human error, we have to be better than humans, but yet we're holding autonomous to a standard of perfection, where if there's a single death, then there's a hue and cry to let's get all the autonomous vehicles off the road. But if autonomous vehicles only killed half as many people as humans, I think we should all be cheering for autonomous vehicles because we'd saving 20,000 lives a year. But for those of you that work in this field, just share with me your perspective on both autonomy and on the time perspective of why 30 years on Road to Zero versus something shorter.
Sure. So you're asking one of the toughest questions that we're grappling with right now. How do you provide safety metrics for deployment of an automated vehicle? A lot of people would say it needs to be at least as safe as a human driver before it can get on the roadways. Well, we have over 37,000 fatalities on the roadways right now. Do we think that human drivers should really be that standard? I think that's debatable. But we are looking at how we can prove these out and how we can actually make sure that when they are deployed, they're done safely. Right now, there's nothing on the roadways that's fully autonomous. There are some test vehicles that are under research and development, but they all require a human safety operator who's in the vehicle or in very close proximity. When it goes back to your other question about why a 30-year time horizon, even if these vehicles were ready to go today, you would still have, someone mentioned it earlier, the lifespan of a vehicle right now for an average car, a new car, is 12 years. So you would have 12 years before the turnover of the fleet occurs, and you actually have more and more of those automated vehicles on the roadways. Anything we can do to make a dent in the overall number of fatalities is important, but it's going to take some time. And in the interim, what we're focused on is improving behavior to make sure that motorists are driving more safely.
I would just add that there are, part of Road to Zero, there are sort of three core components to Road to Zero. Doubling down on what we know works, these sort of proven evidence-based interventions. Some of the technology, autonomous vehicle technology that exists is the second pillar. And the third, as has been mentioned a couple of times, is looking for ways to change the culture around safety. Again, I mentioned that statistic from the early 1980s around seatbelt use rates. The social norm around seatbelt use has changed in this country, and I think more broadly, as we think about a safety culture, we need to own up to and lean in on the importance of safety, because the U.S. compared to other high-income countries, we have nearly double the crash fatality rate as other high-income countries, and the country with the best rate is a quarter of the rate that we have here in the United States. So again, there is existing both evidence-based interventions and rules that govern how we all drive that can lower the rate quite substantially.